Thank you, respected chairperson, co-speakers, and my dear friends. You have stood for 15 minutes, sir. I think you have to break and sit. So, after two interesting talks on insulin and fixed dose combination, which are basically for the benefit of patients, I think I should thank Dr. G VK for having a talk for benefit of doctors also. So, my talk is going to be on too much sitting during practice, hazards to physicians. So, this is the overview of my talk. We all know as a physician, we often sit for extended periods during patient consultation. It is not only consultation, but for other administrative tasks, other reporting, even in teaching professions, Dr. Sriram would agree, there will be so many meetings and board meetings where you tend to keep sitting most of the time. And emerging research highlights the dangers of prolonged sedentary behavior in healthcare professionals. So sedentary, when I say sedentary behavior, it basically means whenever you are wake up and your energy expenditure is slightly above the rest, which is less than 1.5 of MET, you call it sedentary behavior. So it's something like you simply sitting in the home or lying in the bed, everything comes under sedentary behavior. And sitting is often seen as a harmless activity, but studies have very clearly shown sitting equates to new smoking in terms of health risks. So even without knowing we are smoking, we are doing it by prolonged sitting. Now you might be thinking why sitting is so bad for us. The why sitting is so bad for us is very, very clear when you try to look at the evolutionary things. So humans are evolutionary very, very active animals. So basically during a growing phase, most of the energy goes for your growth, then most of your energy goes for your reproduction. So your post-reproductive area is very, very important to have a routine physical activity and to decrease your sedentary activity for your health benefits. Although sedentary behaviors encompass large sections of the population, evolutionary biology suggested that humans are not physiologically adapted to periods of prolonged inactivity. When you try to look at the chimpanzees, your hunter-gatherers, they are involved in more and more of physical activity, but now Westerners and even now we do very decreased amount of physical activity and we are more in times sitting. And this prolonged sitting leads to heart disease by lack of physical activity, which can lead to cardiovascular diseases. Lower back and spine, sitting increases stress on the spine and can lead to osteoporosis. Again, depending on the chair what you sit, depending on the table what you use, depending on the gadgets what you use, it can cause mechanical problems. Prolonged sitting also increases your obesity and it can lead to diabetes. And various other vascular problems are associated with prolonged sittings, like too much of time in a chair can lead to blood clots and serious cases, deep vein thrombosis. There's something called sitting vasculopathy, which I would discuss in my further slides. But when I talk about these things, most of the people here would be doing regular physical activity. So you may be doing 1 hour gym or some shuttle game or tennis or swimming or whatever it is. And we feel this physical activity is more than enough for us to save from our most of the non-communicable diseases. But it is not so. There was a very interesting data which looked at patients who are physically active and who are sedentary. So we had 4 groups of patients. One group physically inactive, highly sedentary. Most of the younger generations are like this. They are physically inactive, highly sedentary. There's another group which is physically active but highly sedentary. I am sure most of our doctors who are conscious in health will belong to this group, because they do regular physical activity either in the morning 1 hour or evening 1 hour. Other times they are highly sedentary. Whenever you say highly sedentary, 6 hours if you are sitting in a day, it becomes your highly sedentary and it becomes a sedentary lifestyle. There's another group who are physically inactive. They don't do exercise at all, but they are very, very little time sedentary. So they keep on moving, they keep on walking, all those things. There's another group which is physically active and slightly sedentary. This group definitely scores better, there's no doubt. You are physically also active, you are not sedentary. But compared to those group which are physically active and highly sedentary, those group who are physically inactive and slightly sedentary, they scored better. So which means more than your physical activity, decreasing your sitting time and decreasing your sedentary lifestyle is very, very important, because prolonged sitting leads to various cardiometabolic risks. There's an increased risk for type 2 diabetes due to insulin resistance. Hypertension, obesity and elevated triglycerides are seen with prolonged sitting. There's a poor blood circulation which raises a deep vein thrombosis And sedentary time more than 6 hours per day is linked to cardiovascular mortality and various other complications. You may ask me, how does this happen? So sedentary behavior, as I said before, any waking activity which is characterized by little energy expenditure, which is above rest, which equates to less than 1.5 METS, reduces your cardiac function by decreasing your stroke volume, by decreasing your diastolic function. It reduces your vascular function by decreasing your blood flow and decreasing endothelial function by increasing arterial stiffness. It also reduces your muscle function by decreasing your muscle strength and muscle mass, which in turn leads to decreased cardiorespiratory fitness, increased fatigue, and ultimately increased cardiovascular risk. And studies have very clearly shown when you break this sedentary behavior and when you interrupt this sedentary behavior, you have various benefits. So this was data with sedentary behavior which leads to increased blood pressure and decreased flow mediated dilatation, and molecular level it could have various effects on your shear stress and various aspects, but when you break it, your blood pressure decreased and your flow mediated dilatation improved, thereby you had a benefits in your cardiovascular health. The next common problem with your prolonged sitting or sedentary behavior and your physical inactivity is your diabetes mellitus, hypertriglyceridemia, and various other metabolic complications. So sedentary behavior decreases your mechanical overload, it decreases, it causes inflammation and oxidative stress, which in turn leads to hyperglycemia, hyperinsulinemia, and various complications. Apart from this, which happens throughout the body, your prolonged sitting has varied effects on your skeletal muscles, whereby it decreases your insulin sensitivity, it causes fat accumulation in your skeletal muscle, it causes decreased free fatty acids, and which in turn again can affect in your adiposity, and even in your liver it can affect your fat accumulation, which ultimately causes hypertriglyceridemia. And again there was a very interesting study which looked at your area under curve or your postprandial hyperglycemia. So this was a group of patients, one with uninterrupted sitting, another group with prolonged sitting with slight intensity exercise, another with sitting with moderate intensity exercise. People with more interrupted exercise during your sitting, they had a better glycemic profile than other patients. As I said, your prolonged sitting affects your cardiovascular health. It causes hyperglycemia, it causes hypertriglyceridemia, and another important aspect is whatever I said is a sitting leg vasculopathy, where your posture in a particular thing can cause a low shear stress stimulus, which in turn can cause your remodeling defects, which can cause effect on a vascular smooth muscle, and which can have a varied problem in your cardiovascular health. So moving on from cardiovascular health, you have various other musculoskeletal hazards with prolonged sitting, back and neck pain due to poor posture and static positions, and lumbar disc degeneration and cervical strain from slouching, and repetitive strain injuries in wrist, shoulders and elbows, joint stiffness in hips and knees from lack of movement. I am sure this back and neck pain due to poor posture and static position we all would experience in most of the conference. I could see most of you sitting here, we cannot sit in the same position for more than 5 to 10 minutes. We keep moving here, we keep moving there, we try to sit erect, and all these things our body adaptations we try to do it, because otherwise you end up with various musculoskeletal hazards. So apart from these mechanical problem, your prolonged sitting in your practice as a physician, it can have an effect on your mental health impacts. So it can cause your mental fatigue, it can cause your brain fog, and it can cause lower productivity. And the increased risk of depression and anxiety disorders are seen with prolonged sitting, and especially due to reduced serotonin and dopamine from inactivity, and your social isolation in tech heavy roles contribute to emotional stress. So probably now even as a doctors we have become a tech heavy roles, because very few of us write our prescription. Everything has become computerized. You become more and more typing most of these things, and all these things can have a varied mental health impact. So this we can commonly see in our day-to-day practice. So most of our patients come and see us, suppose your OP time is between 9 to 2, most of our people try to come and see us by 1:45 or just 5 minutes before 2, because they feel that's the time doctors should be free. But that is the time we are totally in our mental fatigue and brain fog, where our decision making becomes very, very bad. So your prolonged sitting can cause all these things. And this again, there was a very interesting data which looked at your brain functions and your sedentary behavior. So whenever you have a sedentary behavior, so there has been data to show there's increased cerebrovascular resistance, decreased cerebrovascular reactivity and vascular activation, decreased cognitive function, which ultimately leads to brain function. But while you reduce or interrupt your sedentary behavior, all these things reverses, and there's an increased cerebrovascular reactivity and vascular activation, which in turn improves your brain function. And there had been a lots of impact on work performance, reduced concentration and slower decision making, higher likelihoods of medical error, burnout, fatigue and job dissatisfaction, and long sitting hours are linked to physician absenteeism and presenteeism. So how do you prevent from all these things? So preventive strategies, you can use ergonomic adjustment. The chair, whatever you have been using, you can have adjustable chairs with lumbar support. I think now you have chairs with some of the massage kind of chairs are also available. Though we may not be moving, it helps your muscle contract and relax during most of the time. Sit, stand, desk and anti-fatigue mats can be used. Monitor at eye level to prevent your neck strain. I am sure your table, chair and your computer, what you have been using, should be very appropriate. Always take a micro break, which means 2 minutes movement breaks every 30 to 60 minutes. Use apps or timers to prompt activity, and that I think that is one reason why most of the weight reducing apps, they succeed, because they keep on reminding you, and these apps keep on tracking you what exactly you have been doing. So other preventive strategies what could be done is routine. You can have a walking meeting. Whenever your friends have been coming, you can do a walking meeting. What I generally tell most of my patients, or what I generally do, is walking talking. Whenever you have a mobile which is ringing, you take the mobile and start walking. Because most of us would be talking in a mobile for at least 1 hour, which could be your patients, which could be your friends, or which could be some work related. So you just, once when a mobile ring, you take walk even in your OP, so that you are moving away from your patients. So patients may not feel uncomfortable, and that takes a micro break. So if you have been talking 1 hour, I am sure I have done 1 hour of physical activity. It's not necessary I have to go to gym and do a 1 hour of activity. So I tell most of my patients, whenever your mobile rings, or whenever you want to talk to your friends, whenever you want to discuss something with your friends, whenever you want to plan a conference, do walking and do it. And most of the Zoom meeting can be done through walking also. So which definitely helps. And we can go for other wellness programs like yoga and guided meditation, but all those things consumes time. Fitness trackers can be done, and keep track of your BMI, blood pressure, and look at your glucose levels and cholesterol. And fitness trackers, as I said before, it helps you to track your steps and your movement. Another easiest thing which could be done in our routine practice is that what is called as non-exercise activity thermogenesis, or what you call as a NEAT. So there have been various forms of NEAT which has been practiced. So one thing which has been commonly practiced is that standing. Most of I see some doctors who stand and only see the most of the patients. I am sure Dr. J.C. Segar does the same thing. Samuel sir does it, and most of the doctors, they do it. And there is something called pedaling. Whenever you want to do sitting and doing the job, you can have a pedaling chair could be done. You can have a walking thing can be done, and you can have a ball where you can also do these things. So all these things are feasible. But another thing what could be easily be done in our routine practice is that most of us, whenever you have 2 or 3 consulting chambers, you can tell the patient to sit on a chamber, and you can keep on moving to one chamber to other. So that saves a lots of time, and that will give you time also, because whenever a patient wants to enter your room, he takes minimum 30 seconds to come and sit in the chair. And when he wants to leave the room, again it takes 30 seconds. And nowadays what happens, most of them, they don't bring hard copy, they keep on searching the mobile, it consumes another 30 seconds. So 1 hour 30 minutes for the patient is spent without any usefulness either for you or a patient. In such case, when you have another patient in the room, you can walk it where you are going to move within 20 seconds. So you will say 1 minute for a patient, so which means you are seeing 50 patients in a day, you will say 50 minutes. I think 50 minutes is a major chunk of time what you can get in a day. So this again could be done. And just to conclude, prolonged sitting is a silent occupational hazard for physicians, and it is called as a smoking risk also. Small consistent changes in the workplace can make a big difference. Cultivating a proactive culture of health and movement benefits staff for the patient should be done. And thank you so much.